My favourite thing about student clinic is having a bunch of other students around you that can really help support you, and having the lecturers there to bounce ideas off and give you extra information. And as a student, you just really need the support.
Really, it's just like being a practicing acupuncturist, but with some guidance.
The practical component of the acupuncture course here is the most important thing. We do hundreds and hundreds of hours. You just learn things that no one can teach you in a theory subject. You learn how to be around patients, you learn your own style of how you want to treat, you learn how to be around different tools, you learn how to use those tools. Those hours you will not get anywhere else.
They do basically what an acupuncturist does. So they interview a patient, finding out what their main complaint is, what their problem is, and working out a diagnosis from a Chinese medicine perspective, and then performing a treatment. The only difference between being a student and being a practicing acupuncturist that's no longer a student is that in between that time of talking to the patient and diagnosing, and then treating the patient with needles or moxa or whatever they're using, they'll come and speak to the supervisor, so that the student and the supervisor are both really 100% sure that the direction the student's going in is the appropriate treatment for the patient.
You get so much experience so quickly that by the end of the degree you've had so much experience in a clinical setting, it really does set you up.
It's almost like being a practitioner, so it's a really nice transition from being a student into being a practitioner by being in the student clinic. But that safety net of having somebody there to check your work and help you.
There were some amazing clinical supervisors, also had some great lecturers, so through that, so much support in what you were doing in clinic, able to discuss cases with lecturers and really go over that sort of thing.